Every 2 minutes, someone dies from sudden cardiac arrest. Even with today's scientific knowledge, the cause of sudden cardiac arrest is not fully understood. Many victims have no history of heart problems, nor do they have any prior symptoms. Sudden cardiac arrest can strike anyone, anywhere, at any time. Knowing the 4 links of what is commonly referred to as the cardiac chain of survival can prevent many deaths. Cardiac chain of survival is the recommended treatment for sudden cardiac arrest. It consists of 4 links, all of which must take place quickly to ensure survival. The 4 links are early access to care, early cardiopulmonary resuscitation or CPR, early defibrillation or electrical shock, early advanced cardiac life support. This program explains each step and shows the importance of becoming certified to be a link in the survival chain at your facility. If you're already certified, this material should be familiar and serve as a refresher. If you are not certified, this program will not give you certification, but it will familiarize you with what you will learn at a certifying course. Sudden cardiac arrest is usually due to abnormal heart rhythms, called arrhythmia, most of which are ventricular fibrillations. Ventricular fibrillation is a condition in which the heart's electrical impulses suddenly become chaotic, causing the heart to stop pumping blood effectively. A victim collapses and soon loses consciousness. Unless a normal heart rhythm is quickly restored, death will occur in minutes. It's vital you act immediately. First, assess the situation. Make sure there are no hazards that may affect you. Next, try to get a response from the victim. Tap him or her at the shoulders and shout, "Are you okay?" If the victim is unresponsive, call 911 or your community's equivalent emergency ambulance service, or tell someone else to. Give the operator the victim's exact location and apparent condition. CPR doubles a person's chance of survival from sudden cardiac arrest. Just concentrate on the victim's airway and breathing. Let's start with adult CPR. Place the victim flat on his or her back on a hard surface. Then open the airway. Tilt the head back with one hand and lift the chin with your other hand. Always keep the airway open this way, even while giving breaths to the victim. Put your cheek close to the victim's nose and mouth and look toward his or her chest. Look, listen, and feel for normal breathing for up to 10 seconds. Abnormal breathing, which sounds like grunting, gasping, or snoring, does not count. It disappears in 2 to 3 minutes, so do not delay CPR. If the person is not breathing and a microshield or pocket mask is available, pinch his or her nose closed and blow 2 full, slow breaths into the mouth. Make sure you have a tight seal around the victim's mouth while you blow, and watch for his or her chest to rise. Allow the lungs to deflate between breaths. If your breaths don't go in, reposition the head and try again. If the airway is blocked, check for an object that could be choking the person. With a hooked finger, sweep deeply into the mouth to remove anything there. Then reopen the airway and give 2 breaths. Next, begin chest compressions. Perform the compressions like this. Place the heel of one hand on the victim's lower sternum in the middle of the chest. With your other hand directly on top of the first hand, push down 1.5 to 2 inches. Compress the chest 30 times, and then lift and tilt the head back again for 2 more breaths. Go back to 30 chest compressions, then 2 more breaths. Remember, 30, 2, 30, 2. If you hear a cracking sound when pushing down on the chest, don't be afraid. Cartilage or ribs may have cracked, but that's nothing compared to what will happen if you stop CPR. Always continue until medical help arrives, or until the victim moves or regains consciousness. When the victim has a pulse and is breathing, move him or her into the recovery position on his or her side. Use something to support the head. This prevents the person from choking on saliva and helps keep the airway open. While you probably don't have any children working at your facility, you may encounter a situation where you need to do CPR on a child or infant. Here are the differences in performing CPR on children and infants. For children 1 to 8 years old, the steps for performing CPR are similar to adults, but there are 4 differences because of the victim's size and physical immaturity. The differences are: if you are alone with the child, give 5 cycles of CPR before calling 911. Use the heel of one hand for chest compressions instead of 2 hands. Press the sternum down 1 to 1.5 inches only. The breath-to-chest compression ratio is the same as for adults, 2 breaths to 30 chest compressions. The reason you should perform CPR for 5 cycles before calling for help is because rescue breaths alone can revive some unconscious children if they aren't suffering a cardiac problem. Providing those breaths takes precedent over calling 911. If the child does not begin to breathe, check for an obstructed airway. Look down into the airway and use your finger to sweep away the object only if you can actually see it. CPR for infants under 1 year of age is similar to that for children ages 1 to 8, but again there are some differences. As with children, if you are alone with the infant, perform CPR for 5 cycles before calling for help. When trying to open an infant's airway to check the airway and breathing, don't tilt the head back too far. Give 2 small, gentle breaths into the infant's mouth and nose by covering that area completely with your mouth. Each breath should be 1 to 1.5 seconds long, and you should see the baby's chest rise with each breath. If the chest does not rise, the airway may be obstructed. Begin chest thrusts to dislodge the object. Use 2 or 3 fingers on the breastplate and compress 1/2 to 1 inch to perform a chest thrust. After 5 chest thrusts, check the airway and breathing. Continue until you see the chest rise. If there is no response or breathing, begin CPR. For chest compressions, use only your 3rd and 4th fingers to press gently in the center of the chest, 1/2 inch below the nipples. Press down 1/2 inch to 1 inch only. Just like for adults, use a 2 breath to 30 chest compression ratio and keep the breaths gentle. When an individual goes into cardiac arrest, every minute that passes reduces their chance of survival by almost 10%. Technology has created a tool to help increase the survival rate: the Automated External Defibrillator, or AED. Defibrillation, which is delivering an electrical shock to the heart, is the most critical step in restoring normal cardiac rhythm and resuscitating a victim. In the past, only emergency medical responders would use AEDs when called to a scene. But equipment advances have made the procedure simple for anyone to be trained to use. Many public facilities fall under a Public Access Defibrillation, or PAD program. That means there is at least 1 functioning AED on site, and trained staff are able to respond within minutes of a collapse. An AED is easy to operate. It uses voice prompts to help you. Once the machine is turned on, you're told to apply the 2 electrodes to the victim's chest so the AED can monitor the heart's rhythm. If a shockable rhythm is detected, the machine will charge itself, then instruct you to stand clear of the victim and press the shock button. AEDs are also safe for children as young as 1 year old, but pediatric-size electrode pads should be used to reduce the shock to a level more suitable to young children. Although AEDs are easy to use, training is still necessary to completely understand their role in cardiac survival. Early advanced care includes basic life support measures, plus more specialized care. This care may be provided by paramedics, nurses, or doctors. Unfortunately, about 2/3 of cardiac arrest deaths occur before the victim ever reaches the hospital. You can change those odds by being a strong link in the chain of survival. Know that your efforts make all the difference, not only to the victim, but to the family and friends of the victim. If you ever need to perform CPR, during all the activity, you may wonder if you're doing it correctly. That's why it's important to attend certification courses. It gives you confidence. Even if you have received the proper training and certification, you may still doubt your skills. But don't worry, the training comes back to you and you'll do fine. Always keep in mind the 4 parts of the chain: early access to care, early CPR, early defibrillation, early advanced cardiac life support. You've seen in this program that you can be a strong link in this chain of survival. If you're already certified, brush up on your training. If you're not certified, make time to get certified. Someday your skills could save a life.